the good news. Okay, so let's start with, as usual, the COVID questions, the COVID updates, and what else is going on in the world of COVID. So the Stratus strain completely taken over the country. I guess the Nimbus is now less than double digits in many states. In some states, it's now single digits, and Stratus is supposed to be close to 80% around the country. I did not see any new data on this strain in terms of the severity and anything else. It looks about the same. I had a lot of patients getting COVID in the last week, maybe 2 or 3. That's a lot, I think. And so far, most people recovered okay. Some of you here still dealing with this, you know who you are. So, it's just as we would expect. It's still here. We can't ignore it. So now, with the updates on vaccines, real quick, looks like all the states don't ask for scripts anymore. There was this period of total confusion. Some people in DC had to get scripts. I kept writing them, and suddenly everybody tells me, no, we just go in the pharmacy and it's all okay. So I guess don't wait if you are been a year or more and there's no specific reason why you shouldn't be getting the booster. Go ahead and get the booster. I still think you should get COVID first and then a little bit later get a flu. Again, you heard me say this 10 times. I'll say it again. Don't take the same shots. Don't take both shots on the same day. There's no real need for that, unless you're super busy and you want to save a little bit of time. But it's safety-wise, it seems to be more logical to split the shots by about 2 weeks and do the prep that, again, we discussed for each of those shots. And let's see if I have anything else to report. I don't think so. Yeah, if you're GW patient, please note GW decided not to stock the COVID shots. I think they may be considering it now that the script requirement went away. But they were discussing stocking the pharmacy. I don't know where things are. So just go to your local close pharmacy if you need to do it, and just tell them what you need. And apparently pharmacists carrying one or the other typically. So you may need to ask around if you know which one you want to get. My stand on this is simple. If you tolerated one before, get the same one. If you didn't tolerate, get the other one. That's my only logic. I think that the safety profile and the nitty-gritty, the difference between the two is so small that I really don't think there's any specific rule. There was some information early on that Pfizer may have been slightly safer because the dose is a little bit lower. I don't know. I don't think so. I haven't seen anything conclusive to push, especially since we don't really have any updated trial on the boosters, so you'd use the old data that's now dated anyhow. So, all right, let's do Q&A and then we'll go from there. I have a couple other updates to give, but I want us to make sure we spend whatever time we need on the COVID itself. Okay, first COVID wax, I had an instant reaction. There was a funny in my blood pressure spike. Yeah, that's possible. Yeah, I think it's fine. Meditate a little bit before. Most likely your blood pressure spikes in the offices, so we called it white coat hypertension. Randall, you may want to check your home blood pressure like before you head out, say somewhere. Chances are you're going to be quite surprised. Most people in the office will always have a little bit higher readings than at home. That's what we called white coat hypertension, even though I don't think this group ever seen me in white coat, probably, but that's still, it's a perceived white coat, even though today it's blue. So yeah, 159 is a little high, 140 is fine. Again, you and I kind of had this a little bit on and off. I think you just need to get this managed. I presume that maybe your leg swelling is somehow linked to this. It's very typical, very common. So, if you're taking any pain pills, make sure you're not taking Motrin, Advil, or any of the NSAIDs, because they can both cause swelling in the feet and increase the blood pressure. Good. All right, so you have a plan. You'll sort this out. Very good. Let's see. What date for the flu shot? You have said. Okay, great question. So, Cecile, thanks so much for that, because I think I'm going to talk about this for the next couple of weeks, every week. Remember, usually my recommendation on flu shot is push all the way to late October, even early November, because flu rarely arrives before then. It's different this year. Flu is already here. So don't wait too long. Choose which shot you're going to get first. If you like, in case, for example, since I'm looking at Linda and then her next question, like Linda is not going to get a COVID booster because there's no sense. She just had COVID. So like go get a flu shot soon. Because I mean, I would probably wait until you get over whatever it is happening. Once you get a little bit better, go get flu shot if you ever get them. Because I wouldn't wait here too long now. We're gonna have a very unusual flu season. I'm hoping it'll pass quickly. I just hope we're not gonna get the what's called a bimodal distribution, that we will have spike now and then the spike in the spring. If that happens, if you get the shot now, you're not going to be protected in the spring. But there's no way of knowing that. That's actually the reason why I push everybody to get shots later, because I want you to get protected against all the way to the spring. If you get shot now, it's not going to last that long. The COVID flu shots don't last for more than 3, 4 months. It's called a high, Linda, I'll come back to your questions, but Cecilia's continuing with this. So what shot to get? It should say seniors, or sometimes it's called high potency or quadrivalent. All of those terms correct, but make sure you get the single vial, right? So don't, if you can avoid dimerisol, avoid it. If you can't, I guess it's probably okay if you get one shot a year, but it's easy to avoid. If the particular pharmacy doesn't carry single vial, just go to another pharmacy. Most of them will carry single vial. It's the same cost theoretically. Or, well, you're not supposed to pay anything for flu shot. If you have insurance, it's all covered. And they'll cover either vaccine. The single vial or multi-use, it should be the same. Okay, back to Linda's question. Why is not meaningful to COVID kit test for 5/7? Um, because because you're going to be positive for quite some time. I mean, the antibodies half-life is pretty long. So you may be 4 weeks out positive, but that doesn't mean anything because you already cleared the disease. That's the problem. So if you test negative, great information. But if you tested positive, you shouldn't necessarily go and, get upset over it and say, oh, I have to keep isolating. No, that's not the case. That's part of the problem. The part of the problem is that clearance of the test occurs in only some people. It's not universal. And then if you don't clear, the positive result is not very meaningful. That's the issue. Because you don't really know. I mean, let's say you still persistently have symptoms. Just presume for a second. You get the test and it's positive, and you're like, oh my God, so I'm still having an ongoing viral infection. No, not necessarily. You may just have post-inflammatory response and the virus tests positive, but if you were to run PCR, which would be the better test, then it'll be negative. But PCR tests, you have to go into the lab. Physician has to put the order. I don't even recommend it. I mean, that may only make sense if we're still wondering why you're sick. Because theoretically, there is a situation where a person doesn't clear the COVID. We've had cases. They're rare, but they've been reported. So it's theoretically possible. And then in that case, it may make sense to run the actual analysis of the blood. But I'm trying to remember if I've ever done it. I don't think I've ever done it. Because most people, it becomes pretty clear that you kind of get a little bit better. And then if the long COVID hits, long COVID definitely does not have the live particles. It could have some continuous immune response, sure, but it doesn't mean that the virus is physically alive there. I mean, there's still immune response, the memory. So good question, actually. All right. Moderna advises on TV a COVID vax for seniors? You talking about flu or COVID? Yeah, there is a there's a senior flu shot. COVID. No, there's no such thing. There's only two shots. There's only one with Moderna, one with, well, I don't, Novavax, nobody seems to be able to get. I mean, it's supposed to be available, but I haven't seen it or anyone reported getting it. I think they're still making it. Otherwise, no, there's just so I think maybe what you're thinking about, there is a bunch of boosters for kids. So when you're getting the COVID booster, you have to make sure it's a full dose. For Moderna, it's 50 micrograms in half ml. That's the actual dose. For Pfizer, it's 30 micrograms in also, I think, half, or maybe it's zero point 0.3 ml. I think it's 0.3 ml, so it's a smaller volume. But I am not aware of any specialized COVID senior booster. I don't think such thing exists. So was that your question? Okay. All right. Okay. Any other questions? Otherwise, I'll switch to a couple other topics to cover. Okay, you guys think of questions. So let me show you a couple of things. So first of all, those of you who were there last, well, it wasn't last Saturday. When was it? Not not this Saturday. Yeah, last Saturday. So we finally gotten the recording of Beating Heart Retreat up. So I'm going to put it here for you if you're interested. If you were there, you should have already gotten the link if you signed up for the event. That's just the recording. I think it went really well. I talked too much as usual. Angela told me not to curse word in the recordings, but you know me. I'm too passionate about the shit that we're in, pun intended here. So, sorry if I was a little rude about some of the modern medicine practices, but I think we had a good conversation there. So we're gonna continue with this. I will tell you that since then, NAS is now gonna hold similar event at NAS on the October 30th, and that's gonna be an official NAS DASER program. So what I'm gonna do, you're all welcome. It's all free, so let me just Google this. So it's called DASER program. DASER at NAS. And so it's kind of going to be a little bit similar to what we did on Saturday. The difference is going to be, it's going to be a little bit more of a conversation rather than, I don't think we're going to do much practices. I'm sure that Fred's going to sing. I have no doubt, but it's going to be more of a conversation. So I'm going to give you a link. Now, I don't see, how do you sign up for the next one? Oh, okay. Here, it's already announced. So here, I'm going to give you a link. So if you like this topic, I hope we'll see you there. It's in person. I think I do think they recorded and placed it somewhere, I presume, but still. Um, so yeah, take a look. And I think it's just going to be same way. It's going to be Fred, myself, and I don't know if JD is bringing anybody else. I think it'll just be just two of us talking about kind of the mysticism and the sound and the healing. Going to be kind of similar. But now it's officially an AS activity. So it's in their building, under their auspices, sponsored by NAS. So if you've never been in an AS building and you're local, I highly recommend before something happens and NAS loses its building. In this climate, you can't predict anything anymore. Okay, so enough politics for tonight. So that was one. So if you like that. And then the other thing, I think I promised you guys that I will share the podcast that I did with Scott Shannon on the ketamine and mental health. I felt it was one of the best podcasts I've ever recorded. Well, Janet and I recorded it. And the reason is because Scott is a very, very unique communicator, and he's the way he describes some of the stuff that we talked about is quite different from a lot of other things you're going to see out there. So I do suggest you guys check it out. Don't worry that the topic is mostly ketamine. He talked a lot about mental health, period. It's a much more about gaps in the healthcare for mental illnesses, he is taking one of the sickest populations, and so he's the one of the founders of a integrative mental health organization. I forgot what they're called. They have this large conference now that all these big names attending. So Scott was the one of the co-founders of this, and he's been doing this forever. So check it out. I love him. He's been my mentor when I was medical student, and I don't know. I kind of find myself in a funny position because I did my training in integrative medicine right at the cusp where it was still not required to do the fellowship. So I ended up kind of hanging out with all these people myself. Like I went and spent a month with Andrew Weil in Arizona. I spent a week with Scott in the fourth year of medical school. He was teaching at our wilderness program. We had this 1 month in Ben Lomond in California. So Scott was there for a week with us. So anyway, and now I find all these people are colleagues, which is kind of cute, cool. All right. Building. I think it's in the main NIS building. I mean, I think all of their programs is in that building. And it's they do also have a free parking on site. So like if you're driving in, if you're registered and driving in, they have a little parking, right? At NAS, yeah. That link should have a description of everything. So, and I don't know, I think they do try to offer Zoom option for every meeting. Check it out. I don't actually know what they're going to do this time. It does vary. Sometimes they don't do Zoom. It depends on capacity. There is some, they have two buildings, actually, you're right. So I'm glad you asked. Because there's a main building, the old one, right next to the mall. And then there's a newer building in Chinatown. So I don't actually know which one it is. But I sent you the link, so it should spell everything out in that link. All right. And actually, that's all I have. I don't have anything else for today. There's going to be a couple more podcasts coming up to be recorded and placed on YouTube. So, well, of course, we'll share that. What Janet and I discussed right when we were opening, that's a bit more specialized. I don't think this group is going to be interested in this. We have a large paper coming out in JAMA saying that every medical student must learn about cannabis, and here's the ground rules how to do it. So that's a big deal. I mean, it's going to be hopefully featured in some major outlets, but that's very specific. It's a medical education article. It's not, I don't think anybody here should necessarily spend time reading it. I mean, it it basically comes out after we a couple of years ago did this study saying that most patients coming to a doctor is talking about cannabis understand about cannabis more than doctors. And students getting no education, faculty has no idea what they're talking about most of the time. And so we have this big gap where more than half of population has access to medical cannabis and their doctors are clueless. So that this is sort of the point of why the article got created as a big research project between all kinds of collaborators, including some pretty well-known names in space of cannabis and also medical educators. So, all right, well, we have a couple more minutes for questions. If not, then I'll pass it on to Angela. But okay, do symptoms differ from stress? Yeah, so good question. The Nimbus is the one that had that razor throat. Stratus doesn't have that. That's probably the only big difference. And I have not seen any of my patients in the last, I don't know, at least 6 weeks complain of severe sore throat. So I think we kind of just blew through that strain within a few weeks, and now this new one doesn't seem to give it. This one seems to give again a bit more GI than the one before. Other than that, I don't see it being any different. It's just otherwise pretty much the same. I will tell you, do not get like if you only have one kit at home for testing and be ready that the tests are all going to be negative because apparently, and I don't care what CDC says that it's supposed to catch. There seems to be a lot of the older kids that are not picking it up. I've had several patients do 3, 4 tests, they're all negative, and then they'll do PCR and it's positive. So they're saying one thing, but it doesn't seem to be reflecting what's going on out there. So which, by the way, creates a substantial problem, right? How do you know what you got? Because I mean, maybe it's a flu or something. I mean, apparently you can go now to any pharmacy and buy the tri-test. They're a lot more expensive. So that's a flu, RSV, and COVID. They're a lot more expensive than the basic COVID test. They're like $30 a piece because obviously there's three tests. But for some folks, that may actually be a good decision to carry a couple of kits like this at home. Because again, you may not know. And actually it is important to figure out what you have. For example, if the flu progresses severely and you didn't get a shot, I mean, you could get a Tamiflu. I mean, it will kind of work partially. It's not going to fix everything, but it'll decrease the reaction. And I don't know what you would do with RSV, but again, it would be good to know because you would need to, yeah, manage it accordingly. Okay, is there another Moderna COVID one? I don't know. Where's that link? Maybe it just, I don't see the, oh, here. I haven't heard of that. This is maybe old because there was a period when they were trying to do that. But this is 2025. Yeah, I don't know. Or it's just a regular shot. I think it's just it's a regular shot. It's not specific for older adults. I think it's the same one. Let me see. It's just a package differently. It's the same stuff. So the Spikeoax is more potent theoretically. This one's supposed to be less potent. Oh, interesting. So it is a different shot. I have not anybody seen this? Here, let me give you this link. I was not aware that there's a option of getting this. So it's interesting because it's a lot lower dose. It's 10 micrograms versus 50. Hmm. Okay, so they just tested them complete. Okay, it I don't think it makes sense here because so they tested they just separated the age groups and tested it, and it seems like it made no difference really from what I'm reading here. It is surprising though because it's a lower dose, so I would presume it would be less effective, but they're claiming efficacy and safety is the same for both shots. Spikeovax is the one that's in all of our EMRs. I have not seen this other one. Next Spike. I haven't seen that because the systems are now populated with the orders. So I would put the order and send it straight to the pharmacy. I only saw Spikeovax for the Moderna. All right, well, there's always stuff we don't know. Okay, next. Is RSV likely for older people? You talking about the shot? No, anybody can get RSV. Kids even get RSV. It's just typically RSV severely hits people with either altered lung function or altered immune system. So yeah, people over 65 generally has a weaker immune system, so you'd expect that those will get hit harder. My position on RSV, I don't recommend the shot unless you actually either have a substantial immune deficiency for whatever reason, let's say a cancer treatment, or that you have severe lung disease like emphysema, chronic asthma, bronchitic severe bronchitis or whatnot. So then you should consider RSV. If you're just healthy 71-year-old, otherwise I wouldn't. That's again, I'm not basing this on any consensus. I'm basing it on my own reading of literature. Because the only people who truly get in trouble with RSV are those high risk categories only. So a healthy 7-year-old don't really get severe RSV. It's about the same as a cold, really. Flus generally can become more severe. RSV is problematic from only one perspective. If you have some altered lung function, there's very high likelihood of complications. That's why you probably should get RSV shot then. Test for RSV? Yeah, I mean, that's the point, right? So why a lot of people wouldn't not necessarily do RSV test. RSV is unique. The symptoms are different. It's going to look like pneumonia. It's not going to look like COVID. COVID generally you have a lot of kind of diffuse symptoms. I said the Stratus has more GI. Of course, it's flu-like, so you expect some, muscle pain and those things. With RSV, you're basically looking mostly at the lung engagement. That's why it's much harder to separate flu from COVID than RSV from COVID and flu. That's why my proposal is if you're gonna buy some combined tests, just get a flu and COVID only. Don't worry about RSV. You'll save a little bit of money. We last year everybody got pushed to get the shots, but there was very little outbreak. I have not had a single patient with RSV calling me, so just FYI. So I don't know what will happen this year. Okay. If you go to CVS Medical testing, do you know which one I have no idea what I think they have they have their own tests. CVS do make their own kits. So I presume that if you go to their Minute Clinic, they're just going to use their own internal kit because it's the cheapest for them. All right. No pharmacy that I call. You're talking about the lower dose, the senior vaccine? Yeah, I haven't seen anybody say they carry this. So I don't know what that is. It's really interesting you found that. I mean, I'm not sure why they're not utilizing it. I'm guessing it's all politics and money. They probably didn't want to bother because they were concerned that even they just wanted to roll out one shot to make it easier. They're losing a lot of money on this. It's because it's a pretty large amount of work quickly, and vaccination rates drop dramatically, but they crank up the cost. When they were doing it through insurance, they were charging, I think, $30 or close to that. Now they're charging 200 plus. So they increased the cost of these shots tenfold. So hopefully that, yeah. If you have Moderna stocks, I feel for you. All right. Do you know the status of okay, right, great question. Right. So while what Randall is pointing out is something critically important. As of the September 30th, when the government went shut down at midnight, a part of that was supposed to be pre-approving the continuous CMS Medicare telehealth coverage, and it's lapsed. Apparently, they did something urgent, so we got a memo from GW saying keep billing as usual. So, if you're my patient, I will just bill. We were said that they figured something out yesterday or the day before. So I think it's okay. So at least maybe it's because it's local in DC. I don't know what the details are, but my instructions from GW were keep going, keep doing what you're doing. Please talk about egg flu vax versus cellular flu vax. I'm not sure I follow the question. What is that flu vac? What does that mean? I don't understand. It's all the flu shots are egg based. If you mean single vial versus multi-vial, sure, always try to get single vial. Otherwise, I don't think I can answer this question because I don't understand what it's pointing at. Egg vaccines or egg-derived vaccines are very old technology. They seem to be pretty safe. I still recommend the PrEP. I think the difference in the flu shots are right now basically if you're over 65, you want to get a high potency because the lower potency designed for everybody else, the people over 65, the chance of developing immunity is a bit lower. So if you get a regular shot and let's say you're 70, instead of 85 to 90% chance developing decent immunity, you only have about 70%. That's why they giving older adults higher potency. But I have not seen any kind of data saying that high potency vaccines are problematic for flu. Eggs, if you're allergic to eggs, okay, well, you're in a pickle. That's actually why I don't necessarily take flu shots because in the past I had a pretty high reaction, even though I eat eggs no problem, but something in the flu shot triggered pretty dramatic reaction. Like I had a really high fever a couple times. I got it and it was repetitive, and then I just stopped because I only had flu once in my entire life, and it was 24 hours of high fever. And the vaccine caused the flu for about 3 days, and I couldn't work in a day one because I was so sick. So I said, I'm not doing this again. All right. Well, I think we're on time. Um, Pleasure on all mine to introduce Angela. She's been on here before, and I don't know what she has prepared
Sound
for.
check.
Sound check. Sounds is good.
Yeah.
Get rid of my spotlight. There you are.
I just wanted to make sure I'm gonna lead the practice and not the wellness talk, right?
Yeah, just to practice.
Okay. Okay. Because I remember we used to have like 3 people usually presenting here.
Well, my wellness talk was the beating heart and whatever else we talked about. So
All right.
next time when I do something, I'll come up with a better topic. But today we had some busy times in the last couple of days, so forgive me.
Okay, so my name is Angela Gabriel, and Janet already introduced a little bit me. I am fully at GW Center for Integrative Medicine, have been there for many years. I'm mostly actually a practitioner, not an administrator. I see patients for acupuncture, Chinese medicine, and also somatic experiencing. And I do a little bit of administrative work on the side, but eventually my plan is to shift away from there, although I do love working on GWCIM website. I do all the updates, and it's like really my creative part of work. So hello everybody, great to see you. Let me actually just change the view so you can see whole gallery. Okay, and everybody is welcome to be either on the screen or off the screen, whatever really makes you comfortable, because we are going to do something comfortable, hopefully. Oh, by the way, speaking of speaking of white coat hypertension, um, I do have a presentation hypertension. So if I take Misha's advice to meditate before taking my blood pressure, I would need to meditate before leading the meditation, right? Which actually totally makes sense. Yeah. Although my 2 small dogs and the plant, they seem to have perfectly good blood pressure at the moment. So, well, they'll be helping me, and I hope they will stay quiet. Okay, so for today, I just want to take you through just nice, simple sequence to sense your body, to learn a couple or remember a couple of self-regulating techniques which you can use at any time. So first of all, as always, let's just find a comfortable body position for ourselves. Doesn't matter where you are, in a chair, you can be laying down or standing. Just make sure you're kind of well placed, you're safe, you are as supported as possible, and you are as comfortable as possible. So before we begin, even though it's a very simple thing that we're gonna do, just a little bit of breathing and mindfulness, just want to remind you, if you have any discomfort, experience physical or emotional, any kind, just stop whatever we're doing, breathing maybe in a certain way, and you can open your eyes and just make sure you're okay. And if we do any movements, we're gonna do them really slowly and really in the micro range, because we are going to exercise train our nervous system and not our muscles or ligaments. And for nervous system, the actually smaller range of movement and slower and more mindful, the better it works. So everything is very gentle and very soft and very mindful. Okay, and yes, you can close your eyes whenever you want to close your eyes, or you can opt having eyes open, which is soft gaze. But if you feel any dizziness or anything, you can open your eyes always and just kind of recenter. The eyes are very important. They really help us. The vision helps us to orient and feel safe. They already did some practices in the past just for the eyes and looking around, but it's always part of how we begin in somatic experiencing. All right, so we're seated with our feet on the floor if possible. Our intention to be grounded and settle and regulate our nervous system and increase body awareness. And we're going to begin with letting our eyes to explore the space, your room. We can do it by looking around, just taking your eyes for a walk around the room. We can turn our neck, but again, very gently and not much. Left, right, just take your time. Take like a good minute to do that. Just gazing around, noticing some maybe pleasant colors or neutral colors or maybe objects. We don't need to focus really, it's just kind of a scanning. And at some point, also allow to look upwards, extending your neck a little bit, just like those babies when they're on the floor and they want to look up and they just do this. Just not much, just really teeny tiny movements. Yeah. And just notice the light, which is really beautiful today if you have windows. If not, you can notice some peaceful shades. And now let's shift for one more orientation element to your hearing. And just listen to the silence, listen to any noises that are in your room. It could be internal noise, like a little bit, kind of a humming in your ears. Could be my voice. So it could be external sounds, internal, could be something from afar on the street or in the room. Just pick up one or two. Just saying to ourselves here and now. And let's kind of move to our whole bodies now. Let's observe our natural breath just as it is right now without changing it. Just observe how you breathe at the moment. Notice where you feel it, maybe the tip of your nose, the chest, the ribs, the belly. It may be very superficial at the moment, it's okay. Just follow your full inhale and one full exhale. You can feel maybe the temperature, even the texture of the air. You can silently whisper in on inhale and out on exhale. So this is our natural breath. And also it's a great tool. So we will take it to another level using the breath. And we are going to do 3-part breath, or we can call it 2-part. But in any case, we're going to place one hand on your lower belly and one either on upper chest or like a side ribs, like one is lower, one is upper. And we're going to inhale gently, belly first, and then a second portion of the inhale is into the upper rib cage. So it's like 2 parts of the inhalation. And then we're going to do exhalation through either nose or even better through slightly pursed lips, but very naturally, both inhalation and exhalation. Just let them be whatever they are. Don't force them in any way. Kind of inviting a little bit deeper breath, a little bit longer inhalation and exhalation, but we don't force it. It's just an invitation. And let's do several breaths like that. And you may notice how your belly and chest may soften because you're not forcing anything. And one more breath. Inhale in the belly and then a little bit more in the chest. And exhale freely. Just going back to your normal breath, whatever it is for you right now. So next thing, I invite you to place your hands on either on your upper arms or shoulders, or actually can do even belly or hips, but let's try the arms and sit a little bit more upright. You can do it even if you're reclined, though I think it's gonna work anyway. And begin a small side to side rocking movements, just like I'm doing. You could try back and forth. Either way is fine. I just find a side to side for adults may work a little bit better, but you can experiment and try either way. So like the image here would be to move really, really slowly, gently. Again, micro movements. The range is very small, like a seaweed moving in the water. Very tiny, comfortable range. Just kind of like timeless movement. This is very self-soothing. Of course, we all know, how rocking can be soothing and how kids often use it, and we can still use all those techniques that kind of they live in our body. Our body sometimes knows what to do at the moment. And as we continue rocking gently and hugging yourself, which is also self-regulating, can also add one more thing. Soften your tongue. Just simply soften it. If you prefer to keep it slightly touching the upper palate, like usually that's a normal position for the tongue tip, it's okay, you can stay there, or you can soften it and relax and let it kind of be on the floor of the mouth for now. But like really soften. And don't go with all of this, don't go from 0 to 100%. If we say relax or soften, just do slightly, do whatever you can. Maybe 10%, maybe 30. It's all good. Just soft tongue. And keep rocking a little bit. And as you soften your tongue, you may even notice it's just that doing that kind of invites further softening of maybe your jaws or facial muscles and the shoulders. And just breathe in your natural way. And just I'm gonna do it for one more minute, like 30 seconds. And when you're ready, you can relax your arms and just stretch them a little bit. And again, center with your breath. Sometimes when we do this self-regulating little things, as we do them, we just realize like, oh, we want to take a little bit deeper breath, and just really nice to go with that. Or we can notice that we want to stretch, or we notice that there is a bit of kind of moisture in the mouth, just arrived, a bit more saliva. All of these are great things. All of them are telling us that our parasympathetic nervous system is getting kind of in action now, taking the scene, and we're doing good self-regulation. So, and for a couple more minutes, let's just bring some awareness to our arms and legs. We often aware about the trunk because that's where a lot of times we feel tension, emotions, like some chest tightness, some sensations in the belly, in the solar plexus, in the shoulders, neck. Just take a breath and recognize all of that. It may be all there, but we have, our body is larger. We have arms and legs, and we want to bring them into sensing our body. There are a lot of ways to do that. It just maybe just for one quick thing, can sense your feet, your soles of your feet. And also, since we've kind of gotten rocking the body, we can just gently rock our feet towards the toes and then to the heel, maybe pressing slightly against the floor if you're sitting, of course. If you can't do that, you can just stretch your feet or press them against other surface. Yeah, and as you do that, feel the soles of the foot, but also feel how the movement and sensing comes through the whole legs, from the hip through the big bone into the knees, and then through the a little bit smaller bones all the way into the feet. So it's like a powerful sensation to have all this in the body. So, and slow down and come to the pause. And just sense the legs. Sense how they are part of you and supporting you. And take a breath. And same thing with the arms. You can just extend them in any way you want. I was going to do the practice of actually tracing your hand. Like, yeah, you can do it after. I don't think we have enough time, but you can touch your extended arm into each finger with a breath. It's really nice. Like on inhalation, inhale, trace it into the fingertip, and then back on exhale, and do all of 5 fingers. Feel free to try that after the session. But for now, we're gonna just extend them and move the fingers and make the fist and relax. Pump the fist a little bit and relax. Yeah, and then let them kind of like flow, almost like that seaweed that we did with our body. Now we do it just with the palms, with the hands, with the arms. And then slowly let them slowly sink and place them on your legs. And sense the whole body together now. Head, arms, torso, feet, legs, all of it. And if you had your eyes closed, although probably are open, but in any way, let's open them now. Let the light in and do a little bit of orientation again, just looking around the room, welcoming the light, welcoming the features that you had seen before. Now you see them again, back to your space. And take a nice, deep, nice, thirsty breath into the whole body if you can. Yeah. Q, thanks for walking through my little meditation before I'm teaching meditation, which I'm gonna do now. Okay, joking. Thank you all. That's it. What I wanted to offer you today. Take it with you and have a couple more minutes for.
Yeah. Well, thank you, Angela, so much. Let's take a couple of minutes if anybody have questions for you. And of course, Angela sees patients at the clinic. So, I mean, Jed, do you mind put the link to your page when you have a sec? All right, so next week we're gonna have Chris again. Okay, that's good. So I don't know what he's gonna do, but he's gonna do something. We did last time he invited everybody to work on the personal will. I guess that he's gonna talk about his book again. I'm not sure what exactly we're gonna talk about, but it's good. So Jel, I think Irene is asking if you formally teach meditation. You used to, but I think now that our local Sufi center has been closed,
Yeah.
haven't been.
I mostly I don't teach meditation in the groups anymore. It was and you know, of course these groups sometimes, and it used to be other opportunities, but at this moment not. But I do teach a lot of these things during my somatic experiencing sessions, in acupuncture a little bit too, especially breath. Yeah, it would be nice to eventually, you know, develop it into a group or something, but I'm still learning myself. It's really a very fascinating, never-ending world. Well, if you have a second, I can suggest a meditation for everybody that which I oftentimes recommend to my patients. Um, Not everybody has time to meditate. It's really, for some people, it's very difficult. So what my suggestion, if you struggle with meditation, with practice, with time, with like how to do it, of course, I encourage you to still learn it, but you can do meditation in the most simple and most beneficial way. Take one meal, probably lunch would be a good one, but any, and do it really mindfully. Put a time aside so you're not involved into any, you know, you're not studying, not looking at your phone, and just eat mindfully, um, slowly chewing your food, appreciating the colors, textures, and everything, being grateful, all of this you can imagine, but think of it as a meditation actually.
All right. Well, thank you everybody for coming. We'll see you all next week. If you, my patient, you need to hang around, hang around. Otherwise, do